Good morning. This is Rex, and I'm sitting here with Sean Strub from the Sero Project and POS magazine. So he's been a hugely influential person in the gay and HIV positive world. Sero Project has been hugely influential in bringing to people's attention stuff around HIV and criminalisation. Sean, what have you been doing?
Sure. Well, the Sero Project is a network of people with HIV, and we are a national network. We came together specifically to address stigma, discrimination, and particularly criminalization, which is the wrongful use of one's HIV-positive status in a criminal prosecution. Sadly, the United States is sort of leading the world in these prosecutions and passing HIV-specific laws that only apply to people with HIV in about 2/3 of the states. So we've been raising awareness and educating the community and trying to lead that towards advocacy, mobilizing people to change these statutes and to understand, first, the injustice they impose on people with HIV who are being sent to prison sometimes for decades, even though they used a condom and had an undetectable viral load. HIV transmission is rarely part of these prosecutions. These prosecutions are generally about whether someone can prove they disclosed or not a matter of whether there was risk and certainly not whether there was transmission. So we've been doing that education and mobilization, as well as conducting research to show the link between criminalization and testing and disclosure and accessing treatment. Because you can't be prosecuted if you don't know you have HIV. So it discourages testing, and it's become take the test and risk arrest. We're punishing the responsible behavior of getting tested and knowing your status by adding this criminal liability and privileging the ignorance of not knowing your status. A survey that Sero conducted of 2,000 people with HIV in the US, more than a quarter of them said they knew one or more individuals who was afraid of getting tested for fear of being criminalized. And there's other research from Canada that shows quite persuasively that where there are these statutes, people, once they test positive, they are significantly less trustful of public health, which means they're less likely to, and I know this is an area that interests you in particular, but they're less likely to cooperate with traditional disease control programs like partner notification and as well as treatment and compliance programs. So reforming criminalization is, from the perspective of people with HIV, a human rights issue, certainly, reforming the HIV criminalization statutes, but it also is an enormous public health issue. You can either prevent HIV or you can prosecute it. You can't do both.
What would be like a gold standard from your point of view of how public health authorities should regard HIV now?
Well, the consequences of HIV infection today in places where there is healthcare access are profoundly different than the consequences 25 or 30 years ago. For people who do have treatment access who acquire HIV today, they're not likely to die of it. It's no picnic. You don't want to get it. It is a life-changing event, but it is a chronic manageable illness. And if treated properly, a person can have, a normal lifespan. So I think we start with that. Then we have to translate that into not treating HIV in an exceptional way. It is exceptional in the culture because people have all this stigma and fear and long-held prejudices against gay people and people of color and people who use drugs. So it is exceptional in the culture, but that doesn't mean it should be exceptional in the law. And every jurisdiction has assault statutes. So if someone seeks to harm another person, that is their malicious intent to harm another person. Whether they use their fists or a baseball bat or a gun or a virus, they can be prosecuted. You don't need to have these HIV-specific laws. You also have to watch how HIV is used in prosecutions under other laws, because we've reached a point where the stigma is so great and has increased so much in recent years that there's an assumption of guilt. If you show up in a courtroom and that courtroom knows you have HIV, there is an assumption of guilt. We have increasingly become defined as an inherent threat to society, a population that needs to be tracked down, identified, tested, reported, listed, controlled, and regulated. And that has made life, even as the biomedical aspect of the disease is so much better today, the sort of social and cultural aspect of it is much tougher. And people who don't have HIV are often surprised when some of us who do point out how much worse the stigma is today, because they think of stigma in terms of their fear of casual contagion, and they know that is lessened. We all know much more about how the real routes and risks of transmission. But stigma is experienced by the stigmatized is about being othered, about marginalization, and about self-stigmatization. If we are serious about combating stigma, the only way to do so effectively is to empower the stigmatized. There is no movement of a community that has been disenfranchised that has sort of risen above that without being empowered. It isn't imposed on somebody else. I'm much more concerned about empowering the stigmatized than changing the minds of the stigmatizers. And I think this has been the mistake in how we approach combating stigma. And instead, we do these broad public media campaigns that very often end up increasing stigma rather than reducing it. And that's why the networks are so important, because the networks are the embodiment of empowerment of people with HIV when they get together and have their own voice and their own organizations and ability to assert leadership they select rather than leadership selected for us by others.
Okay, so that's been a marvellous slam dunk of information for us to take away. Thanks again for coming. Thanks for being in Australia with the HIV is not a crime message, which sadly it's a new. For many people, it's a new message. It's the
function of the treatment. Up until when we were dying, right, we were victims. There was some degree of compassion. Once treatment came out and the understanding sort of, crept in that we were not going to die, that we were going to live, then we were seen through the prism of our potential to infect as viral vectors, as this inherently dangerous segment of society. There was a time when in the media you would see the stories and the profiles of valiant people with AIDS struggling to survive or raise their families in really admirable ways, right? You don't see those stories anymore. When people with HIV are in the news, it's generally in a criminal context or as a predator or as an AIDS monster, these kind of exaggerated memes that are so damaging to us. Rex, I also want to say to you, I so much appreciate what you wrote several years ago when you got in contact with me, because it helped crystallize some of my own thinking around these public health issues. And I think that is an enormous battle ahead of us for society. In the U.S., the creep of public health towards being more like law enforcement is an extension of the militarization of all of our emergency services in the U.S. The cops, the firemen, it's bigger and more powerful equipment in a more brusque manner, and it's a real problem in the U.S., this militarization of law enforcement. And I think this is just an extension of that. That's grim, but it's a fantastic observation. Thanks. Sean, thanks for coming to AIDS 2014 in Australia, and I hope the rest of the conference goes very well for you. Thank you. It's been a good conference, and Melbourne and Australia have been incredibly welcoming. The community of people with HIV here has been more involved in this conference than I have seen at other conferences in terms of the local community, and that's a good thing.